Hello and welcome to the Supportive Care Services Virtual Lunch and Learn series. My name is Vonsell Hunter, Marketing Specialist with Ironwood Cancer and Research Centers. We've created a series of Lunch and Learn videos to help you be successful when navigating your cancer journey. Our Supportive Care Services Department is here to help you get actively involved in your healing process. For more information about the Supportive Care Services Department, please email us at socialwork@ironwoodcrc.com. Today's featured speaker is Karen Bustillo, physical therapist with Bustillo Physical Therapy, and she will discuss lymphedema and physical therapy. Let's all welcome Karen.
Hi, my name is Karen Bustillo, and I have been asked to give a talk about lymphedema and physical therapy treatment for people that have had problems with cancer. It has become one of the specialty areas that I do, and I've been working with the Ironwood people for well over 9 years now, and really enjoy the working relationship that we have. I am a physical therapist. I am board certified in orthopedic physical therapy, along with being a certified lymphedema therapist. I've been in practice for over 40 years, and I'm also adjunct faculty for A.T. Still University, primarily with their post-professional doctorate of physical therapy program now. The primary reason that I got into lymphedema work and treatment with people with cancer problems is, as a primary orthopedic physical therapist, a number of my patients started coming back to me with having had surgery for different types of cancer problems, primarily breast cancer. And I was always really pretty comfortable working with scar tissue problems, range of motion problems, regaining strength and things like that. But when people started to come in with swelling, we began to understand that the swelling related to lymphedema is not the same swelling that people with orthopedic conditions have. And so I was able to go get certified as a lymphedema therapist, and have progressed my practice into the oncology world and the world of lymphedema. It has truly been a calling for me, and it's something that I truly am blessed to be able to say that I can help with. So what is lymphedema? Primarily, lymphedema is a problem with swelling. There's two types of lymphedema. One is primary, and the second is secondary. Primary lymphedema comes on because of a problem with the lymphatic system from birth. Either part of the system isn't formed correctly, or there's some type of hereditary condition that creates a primary lymphedema. We can see lymphedema in these primary people as young as infancy, but many times it comes on in puberty and occasionally much later in life as a primary problem. The vast majority of lymphedema, however, comes on as a secondary cause to something else. And in the case here, we're talking secondary to surgery and or treatment related to a cancer problem. And that second problem would be radiation therapy that can cause some scarring that would prevent flow outwards. So how does your system work? The lymphatic system begins in the skin all over your entire body, kind of drips lymphatic fluid. And it's a very normal body process. That fluid bathes the cells and helps clean up the waste products of cell metabolism. The fluid then travels up your extremities, your arms and your legs, through lymph collectors, which are kind of like veins are. And the veins, your lymph nodes, and then from your lymph nodes, gets sent to two different places. From your right arm, there's a duct that takes the fluid and puts it into a vein that goes into your heart. And then your left arm and both legs drain into your abdomen. And there's a large duct that takes that fluid up and puts it into your heart. All that fluid goes into your circulation and you urinate it out through the course of the day. You typically produce 2 to 4 liters of lymphatic fluid on a daily basis that needs to be eliminated on a daily basis. So it is a very, very dynamic system, and your body is always trying to keep it going. When you remove lymph nodes, you are removing part of your filtering system, and that can create a backup, because you're going to continue to produce that fluid in your normal healthy skin that then still needs to be eliminated. Not everyone who has lymph node removal or radiation develops lymphedema. It is very highly individual. Some people do, some people don't. Unfortunately, though, it is a lifelong risk of lymph node removal and or radiation therapy. There are 4 different stages of lymphedema, stage 0 through 3. A stage 0 lymphedema is the day of surgery. It is subclinical. There's no outward signs of swelling, but there is that risk of having lymphedema develop. Stage 1 lymphedema is called spontaneously reversible. The swelling typically comes and goes. You'll notice a little swelling here, it goes down overnight, comes back sometimes in periods of heat or high activity, but it generally goes away with either elevation or light massage or really even just resting overnight. Stage 2 lymphedema is considered spontaneously irreversible, meaning the swelling comes and stays. It doesn't recede fully anymore. It can be a little bit larger, but it can be a small amount as well. But it just doesn't go away like that stage 1 does. Stage 3 lymphedema is the lymphedema that we all fear in pictures. It's the very large limbs with skin changes. It's also called elephantitis, and we really never want to get to that level of swelling with anyone. It is treatable, but we don't expect an elephantitis type very large limb to be able to fully shrink back to a normal size. Even with the stage 2 lymphedema, we can get it to match the other side pretty well with treatment. What does lymphedema feel like? Well, typically, there's almost no feeling at all. But some people do report being achy or feeling like their limb is heavier, or the arm doesn't quite move with the same fluidity as the other side does. It's rarely painful per se, but some people do have some pain because the extra water pressure in your system can put pressure on your nerves, and that can be painful. There are some risk factors that we know for sure that can exacerbate a swelling problem. We know that airplane travel or travel to the mountains can be a problem for people. And it's not being at the elevation, it's actually the change of elevation. For some people in the Phoenix area, let's say, driving to Flagstaff, where there is a 5,000 foot elevation change between the Phoenix area and the Flagstaff area, that can give people problems. Some people are sensitive to the point where they have trouble even driving from Phoenix to Payson, which is much lower in elevation than Flagstaff is. And I have some patients that have no problems until they are actually driving in the Rocky Mountains, and that for them is more provocative than driving to Flagstaff, let's say. For airplane travel, Again, it's that change of elevation that can be the issue while they're pressurizing the cabin and then depressurizing during descent. So for short flights, 2.5 hours, we would typically recommend that you wear a compression garment during that whole entire flight. But for longer air travel, flying across the country, flying to a different country, typically once you reach your flying altitude, you could remove a compression garment and then put it on before you begin your descent as you're approaching. Heavy work can be a problem for some people, especially heavy work that's repeated and overhead. I've had people have problems like trimming trees that they don't do on a regular basis. And so some people do need to be a bit more careful with heavy work. And we do know, especially living in Arizona, that the heat can be an issue here. Many people have more swelling problems here in the summer than they do in the winter time. But the heat also can be affected by like a jacuzzi or a sauna. Because a sauna is full body, we typically don't recommend people use them if they are at risk for developing lymphedema. And for people that have a risk for arm swelling, we will tell them that they can get into a jacuzzi to their waist, but maybe their arms should stay out of the water. And if you have the ability to control the heat level, that's always better to have just a slightly lower temperature or fluid. So the issue with heat is that your body produces more lymphatic fluid as a cooling mechanism for your body. And so when you produce more fluid, you have to eliminate more fluid. And if your system is already compromised by the lack of lymph nodes and or having had radiation therapy, it can trigger an episode. So not that you shouldn't do things, you should do things. You should do anything that you want to do, but sometimes you should take precautions. And a precaution would be using a compression garment that is a correct compression level for the problem that you have, whether it's an arm problem or a leg problem. There are different compression levels that we use for either one of those conditions. So what would be a treatment for lymphedema? Your home treatment for lymphedema is elevation, self-massage, self-lymphatic drainage, the use of a compression garment, and then regular exercise. Decongestive exercises are done all the time, and that's mostly range of motion, where you're just moving your body parts through a range on a repeated basis to get the circulation going and to keep your muscles helping pump your fluids, as well as the lymphatic system helping to pump the fluids. Professional treatment, which would be what physical therapists do, would be manual lymphatic drainage, which is a specialized type of a massage treatment designed to clear the pathways and allow improved fluid of the lymphatic system to allow better drainage. We tend to do a little bit more vigorous types of exercise, including strengthening, that has been shown to be very, very helpful in the treatment of lymphedema. We help order and suggest appropriate compression garments for different areas of the body that may need compression to contain and help further reduce swelling. And we also talk quite a bit about skin care. Skin care becomes very important if there is a lymphedema problem, because the fluid in lymphedema actually sits between your muscle layer and your skin layer. And so there is a spacing in there that's a fluid level. And what happens is that the blood flow from the muscles to the skin may not get the proper level of oxygenation to it over time, and that can lead to problems with infection. That's also what makes the skin and lymphedema become harder or more fibrotic and bumpy occasionally. We need good oxygenation getting to all areas, and so skin care becomes very important. And so we do recommend daily use of lotioning to keep the skin moisturized and free from cracks and crevices that can allow a bacteria to invade. So let's talk about some frequently asked questions that we get here in the clinic. Dr. Google can be a very scary place, and so a lot of people come into the office and they'll say, well, my doctor told me I would never get lymphedema. And unfortunately, if you have had even one lymph node removed, you do have a risk of developing lymphedema. It's a low risk, but some people do have some problems with even one lymph node removed. There's a range of lymph nodes that we have in different areas of our body. So in the axilla, or the armpit area, we have between 10 and 24 lymph nodes typically. If they remove one lymph node and you only have 10, that's still 10%. If they only remove one and you have 30 lymph nodes, that's a much lower percentage. And so your risk level would change according to what you have. They're not really looking to see how many you have, but there's an idea in the surgeon's mind about what needs to be removed for the type of cancer that you're presenting with. So it is a risk, and unfortunately, it is a lifelong risk. So if my lymphedema goes away, will it always be gone? Well, we hope so. And for many, many people, they come in and we treat them and they're successful and they go off and they're good for a number of years. But sometimes some people do have to come back for what I like to call a little tune-up therapy. That sometimes the swelling will come back. And then unfortunately, some people do have chronic swelling where the swelling's not at a huge level, but it's at a smaller level, but it is always present. And then the people with swelling in that stage 2, or where the swelling comes and stays level, we'll need to do more regular self-management to help with keeping the swelling at the lowest possible levels. Can you prevent lymphedema? That continues to be a question of debate in the lymphedema world. We like to believe that if we take precautions during risky activities, we can prevent the lymphedema from being a problem. And it seems to work for a vast number of people. I do have people that fly for work and they do 5 or 6 airline flights and they're fine. They don't wear their sleeve, but on that 7th flight, they have a swelling problem. Had they worn their sleeve previously, would it have made a difference? It's really hard to say. Flight number 7 was the problem. Flights 1 through 6 weren't so bad. It just goes to show us that every single person's body is different and does react differently to the outside physical stresses that we place on it. Are there surgeries to help, or are there different types of medications that people can use for lymphedema? There are more and more surgical interventions that we are seeing for lymphedema these days. It takes a microvascular surgeon to perform the surgeries. There are lymph node transfers that are being done that still seem to be slightly more effective for leg problems than for arm problems. And they're also doing a lymphatic venous anastomosis, where they take one of those little lymph collectors and surgically put it into a vein to help the vein help pump those fluids out of the extremity. And they'll do a number of these lymphatic venous anastomoses through a limb segment to help with the drainage patterns. And so we are starting to see more and more of this throughout the country and in Arizona. The only medication that I have heard of to date for lymphedema is ketoprofen. And the studies are out of Japan at this point. It's not yet approved in the United States for use by the FDA. There does seem to be some help, but we don't know where we are truthfully in the evolution of getting that type of medication approved in the United States. So if you have a swelling problem, or if you have an issue, who are you going to call? What are you going to do? The first person that you should call anytime you notice a change is your oncologist. Your oncologist is really your best friend in your journey, and they're very, very responsive to your needs and to anything that is a change for you. If you have a sudden onset of swelling that's new and or painful, they probably will recommend that you have an ultrasound treatment to rule out a blood clot. That's very, very important because there is a difference between swelling due to a blood clot and swelling due to lymphedema. And so we definitely want to make sure that you don't have a blood clot problem before you get treatment for lymphedema, because the blood clot is actually a contraindication to doing treatment for lymphedema. For my patients that I already have been seeing, they know when to call me if they're starting to see a change in their body that they're not happy with. And so we get them right back in. We contact their doctors and help them with that referral process. Although in Arizona, we do not need a physician referral to treat people. I feel that anybody that has walked through the cancer journey does need to have their physicians on board anytime there's a change in their body that may require a different type of treatment than just treatment for an oncology problem. And so what are some other issues that a physical therapist can help you with that we see over the years? Sometimes post-surgically with lymph node removal, we'll see axillary cording, or it's called axillary webbing sometimes. And that can be a situation where the lymph collectors themselves tighten up or go into spasm and create these cords or areas that pop out through the skin and limit a person's mobility and not being able to regain their range of motion. We do lymphatic and soft tissue work through that area and help people get on a good exercise program to help the cording issues resolve. Cording typically doesn't come back once it's managed, but I have seen over the years a few people have had cording with different types of stresses or strains that they've had on their bodies. It's not common to have a cording problem recur, but occasionally it can. We do know that treatment for cancer can cause fatigue, either from chemotherapy or radiation therapy. And almost any physical therapist can help someone get on a very good exercise program that can be safe and effective in helping you return to feeling more like yourself. That's always our goal, is we want you to be as much who you were before your diagnosis as you are after your diagnosis. And really getting on a good exercise program and helping to maintain that program is a great step in the right direction, and to helping you overcome fatigue and strength problems. The other problem that we can tend to see is neuropathy. Neuropathy can come certainly with many of the chemotherapy medications that are out there. We know for a fact that Tai Chi is a very good way to help combat chemotherapy-induced neuropathy. There's been some studies on it that have shown some nice improvements in balance, especially, and that becomes again very important. We don't want people falling when they can't feel their feet very well on the floor. But if you have a lymphedema problem, you really do want to see a certified lymphedema therapist. That's very important. Not every physical therapist is trained in lymphedema management or that type of care. But most physical therapists can really help you with any type of an exercise program and for strengthening and or endurance.
So there was one more thing that I had forgotten to discuss, and that was lymphedema in regards to taking blood pressures and needle sticks. Very important questions for people. The overall medical community wants to stop the emphasis on being so cautious about needle sticks and blood pressures being taken in an arm at risk for lymphedema. The people who treat lymphedema, however, still feel very strongly that if you have swelling in your arm, you really should avoid blood pressures and needle sticks in the affected arm. If you're at risk for lymphedema and don't currently have swelling, my feeling is that one blood pressure, like at a doctor's visit, is probably going to be okay. But multiple repeated blood pressures, let's say if you're having another procedure and they're checking on you frequently, that may be more of a problem for people. And I still feel that needle sticks in the affected arm are best left to the other arm when at all possible, because any break in the skin can introduce bacteria and cause a problem for you, even with sterile technique and everything that we're trying to prevent. We do know that bee stings give people problems with lymphedema. It's always nicer to avoid the problems when you're at all possible to do so.
And that's about all I have for today. I'm really grateful to have been given this opportunity to talk with you. And I'm grateful to Ironwood. Absolutely. It's a great team that you have out there, and I'm grateful to be part of it. Thank you.
Thank you for joining us for our virtual Lunch and Learn series featuring Karen Bustillo, physical therapist with Bustillo Physical Therapy. We hope you enjoyed this session. There will be a replay of this Lunch and Learn on the Ironwood YouTube and social media channels. For more information regarding our supportive care services, classes, and events, please email us at wellness@ironwoodcrc.com. Thank you for spending time with us today.